Okay, I want to be mindful of people's time and start, even though we do have some folks joining us. But let me just share my screen. Again, thank you all for joining us today for the City Health Dashboard March virtual office hours. Sorry, as our tech, hold on. Okay. My name is Samantha Breslin. I am the Senior Program Coordinator at the City Health Dashboard. I'm really excited to be here today and talking about one of the most often questions we get at the dashboard is, how do I download the data? How do I use the data in my own work? And typically, for these virtual office hours, it's me and another associate of mine that are focused on, the program side of the dashboard. But thankfully, we have one of our senior data analysts on the team, Euro Lee, who will be joining us today. And she will walk through all of the ins and outs, do's and don'ts, lessons for using dashboard data on your own work. So just to begin, our goal at the dashboard is to help cities across the U.S. leverage the power of data to improve the health and well-being of everyone in their community. And we do this by providing over 40 measures of health, the factors that shape health and health equity for over 750 U.S. cities. And we were launched back in May of 2018 when there really wasn't a tool or a resource that had data disaggregated to the city and the neighborhood level for cities. Most of the data that was available was either at the county, the state, or the national level, and it wasn't granular enough to really get and hone in on the challenges that that cities were facing, or municipalities were facing on a day-to-day basis. And so we changed that when we launched back in 2018. And originally we had 500 cities, a population that were 66,000 and higher. And then spring of 2020, we reduced our population band to 50,000 and higher. And now we provide data for over 766 cities and growing. You heard it here first. The dashboard is expanding. We're always looking into ways to bring more data to more people. And so you can look forward to more updates on that front over the summer. And we wanted this tool to be an easy-to-use one-stop shop resource for our users. And when we developed the tool, we had it with mayors in mind. But as we have launched the tool and seen it grow and evolve over the past almost 4 years, we have really come to see that not just city leaders are using our data, not just public officials are using our data, but health practitioners are using our data, academics, researchers. There's really so much available that is useful for a variety of different audiences, for a variety of sectors to really gain actionable insights. And we developed the tool along with partners at the National Resource Network, the National League of Cities, ICMA, and NYU Wagner School, as well as really getting input from folks on the ground, from cities and users in cities on what on website design, metric development, potential use cases. We are at we or operate or run the dashboard out of Emily Langone School of Medicine. So it's really important for us, sitting in academia, to have that contact and collect those insights and feedback from actual users and actual practitioners in cities to make sure that we designed a tool that was as accessible as possible. And so how can you actually use the City Health Dashboard? What can you use it to do in your own work? You can, one of the biggest use cases is just using the dashboard and our maps and our visuals to compare health gaps across neighborhoods. And I pulled out a map of West Columbus, Ohio, and I kind of highlight 3 neighborhoods that have really different life expectancies. These neighborhoods span just over a mile, that there's a life expectancy gap of 20 years across those 3 neighborhoods. So the dashboard is really, really powerful, and that kind of highlights these gaps that may exist and prompts you to dig deeper into what could be causing those gaps or those disparities. The dashboard is also a great tool to compare your city to cities in other regions or cities with similar population sizes or demographic makeup, and it can help you set priorities and better target your resources. Especially with as more ARPA funding starts coming out to cities over the next couple of months, tools like the dashboard that provide really rigorous data and very granular visualizations can help us use our resources most effectively. And when we were choosing our measures, we really wanted to provide a really or create a rigorous a rigorous selection of methods that not only reflected public health priorities, but were also amenable to city-level intervention. Our data had to come from national data sets. So, if you're looking at poverty in Chicago, poverty in New York City is measured the exact same way. You're really able to compare apples to apples. We also wanted our data to be updated regularly. This is something that is really near and dear to us, and something that we're constantly looking into is how can we provide more timely data onto the dashboard. We also wanted all of our measures, like I said, we have over 40 measures at this point, but we wanted them to be balanced over 5 overarching domains. So you can see those domains here on this slide, along with all the measures that we provide. All of our measures fall into 5 categories. So we have health outcomes, clinical care, physical environment, health behaviors, and social and economic factors. And all of our measures are listed here, like I said, and any measure that you see listed in blue is available at only the city level, while measures listed in gold or yellow are available at both the city and the neighborhood level. So most of our measures are actually provided at census tract or neighborhood level, which is really, really great. And so with that, I will move to looking at the actual City Health Dashboard website. So the City Health Dashboard is a completely free and accessible tool to anyone who has an internet connection is really able to access all of the information that we provide. All you have to do is just log on to the homepage. And so you can just enter your city here in the search bar. I'm going to enter Kalamazoo, which has all the measures that I just highlighted on that slide previously. So you don't have the data, you don't want to see any measures, but if you're actually more on the overview, we have the city overview, which provides a 360-degree view of how the city is performing all measures. You can see all measures here. So CR, you can click into any of these measures. As you know, what measure is, you'll find a map, a description of where the measure comes from, your location. You can do see measure detail, which takes you to that specific measure detail page. And one of the great things about the dashboard is that once you kind of get oriented to what one of these pages looks like, you understand what every page looks like. So all of our measures, all of our cities have this exact same stuff. You can follow along with this navigation up here, but have your screen. So scroll down, maybe more on the measure. There's the measure shows you on the overview page, and also in here, see more details on the measure, environment, how it relates to health, etc. So this, for around 2/3 of our measures, we have multi-year data available, and you're able to toggle where that is available. You're able to toggle across years here. This CR is represents the range of values for all measures. So in this case, we're looking at housing, excessive housing costs in Kalamazoo. And across all dashboard measures, lighter colors indicate better outcomes, darker colors indicate poorer outcomes. And this blue check mark, it shows you or indicates the direction of those better outcomes. So for a measure like housing costs or excessive housing costs, you want a lower number, you want a lower proportion of your residents or your population experiencing housing cost burden. Whereas for a measure like completion, for example, you want a high number of students being able to here. This blue with maybe triangle indicates the national average of measure, and the gold bar represents the city or the census tract value. So for the case of Kalamazoo, 36.5% of households are experiencing excessive housing costs compared to an average of 3.1% across all the dashboard cities. And this green check mark, while not here in Kalamazoo versus housing costs, is the city or census tract value is better than the average. So just down to the dashboard is the detail map. The detail map should be like 17 colors. You can see you have every neighborhood in Kalamazoo experiencing for this measure. And it's great about these measure that each neighborhood census tract can cover all the and both sides. So it's really easy to see by glance general patterns that neighborhood across. So just look at this pretty clear that these neighborhoods in Southern are experiencing lower housing cost burden, and neighborhoods in Southern are experiencing more housing costs. So I think all these census tracts can really see at a glance how neighborhoods are comparing or compared to each other. Also provide demographic data for measures. Compression numbers and housing costs. For all measures that we don't provide neighbor level data, we try to provide demographic data broken out into so data that's disaggregated as opposed that's disaggregated by race ethnicity as opposed to by geography. And we provide that data for the 5 major racial groups. To move on, the navigation bar. One of the the coolest things about the dashboard is that we allow users to compare their city to really other cities of their choice. So if I'm a public health advocate in Kalamazoo, perhaps I want to compare myself to Flint, Michigan, a sister city in Michigan. Perhaps in Kalamazoo we're always getting compared to Flint, Michigan, and it's not really a fair comparison. Perhaps they're bigger than us, or they have different demographics. We have this city finder, which allows users to select various criteria, various requirements or characteristics that they might want to find peer cities from. So you can choose population size, and you can see what city around, the location, and then you can send the city that has similar, and you choose that, and you can create more filters. That lets the city specifically get those out. And so I just choose Chicago. You're seeing Wisconsin, and I choose the city, right? So those CR, so those actually pull the screen, and you can see they're very cool. So it seems like Illinois is cool. Better than the actual city. I just want to learn Illinois. We know people on staff, and then we'll learn. We'll talk about it. We can collaborate with. We'll have some knowledge sharing this. And we'll learn about what's working in that city. And as with a lot of things that we all deal with in public health or with data, in housing, these issues are pretty large, complex issues. They don't exist in a vacuum. They don't exist isolated from other things. And so we want users to be able to compare measures and see how two measures may or may not move together across neighborhoods in a city. So if you click here, you can choose any kind of measure that you provide. I'm going to look at housing because housing costs and poverty really do go hand in hand, and we get access to that. As much as housing costs, not there, that's really onto the Kalamazoo map. And so just a brief this. So as I said, across all of our measures, lighter colors indicate better outcomes, darker colors indicate poor outcomes. And so we're seeing a new polygon that base out that indicate our excessive housing costs measure, and these guys indicate that indicate social poverty, or the social poverty by growth rates. So we're seeing a very similar pattern where these neighborhoods are showing the housing costs in the center part, and neighborhoods are showing poverty. And this is where the different parts of that, we're not showing housing costs, we're also doing better when it comes to poverty. And you can see this, has genetic or predictive focus on all data. You can see we're going to tight coordination between each measure, each of these dots indicates a census neighborhood, and it pulls up visuals and studies. And finally, for us, we started dashboard. We didn't want people to just view their data and then be like, okay, I'm done. I don't know what to do. I don't know how to move the needle on this issue. So we created what we call our Take Action Center, which is a collection of over 400 actionable resources and tools that users can put into practice locally to move the needle and drive change for various townships. So we have housing programs, which is pretty self-explanatory. It's what you can actually do in your city, and you filter by metrics. So I can show you basic housing costs, related housing programs. We also have buckets that can actually help you to implement your goals. So whether that's finding partners or finding stakeholders that you can maybe include at your table to help you carry out your mission, or other strategies to better advocate with diverse communities, or better communicate science and data and all of that technical language for a lay audience. Also have measures or resources and tools to help you not only for your ideas and for your goals and for your projects, but also have tools and strategies to help you actually apply for that funding. And finally, we have strategies to help you measure your impact and measure and just make sure that the outcomes that you're expecting to have are actually being felt by communities. And finally, back on detail on this because it's really we provide all of our data for free to be accessible and downloadable by users. We have this data in two forms, either through downloadable CSV files or through API, through a data, and then access the access page. Again, right here. With that, I can pass it over to Euro.
Thank you, Sammy, for this info demonstration. Let me share my screen. So now I'm going to present how we want to access our local data and our data. So here are the differences between our downloadable data and our data API. Is downloadable data will have all of our variables and for all of our cities, but we only present the most recent data in our downloadable data. And we have the complete data set, and we also have West data for EDs. And they are in either CSV or TXT format for you to use. And in each data folder, we have one city level data and we have one tech level data. So it depends on your demand. Depends on whether you want to look for the city differences or if you want to do a more granular comparison between cities. There are two different data sets you can access. The API stands for Application Programming Interface, which is a little bit more complicated. It have multi-year data, so all of our data available on the website will be available in our API. But because we already have a large amount of data, so the data will be huge in our API. So we don't provide any CSV or TXT file. Instead, we have JSON column. So the API is really for a person with a little bit more experience with data analysis to use. And next step is that when you go to the City House dashboard data access page, the first thing you will see is a data user agreement. So once you fill this out, you should be able to see this page. So this page mainly focuses on the downloadable data. So we have here as the download complete dashboard data, and also here download data state, and all of our applications are in the starter. So the code will have all the data layout like, and the verbal definitions, and the technical documents are more for the more specific method we use to create this index. Like for example, the housing access it will include because we created this this measurements from ACS, the American Community Survey. The technical document will include all the information on which variable we used, which formula we used to calculate this specific metric. And we are, so for the downloadable data, we, for example, download this data by state. For example, this Arkansas data I just downloaded for this demonstration. It will have five files in the folder. So one is city data, like the city has actual data, city Arkansas, in CSV and XT file, and we also have the track level data, which are also in CSV and XT file, and we also have in the folder. And we open this, I believe this I took was at the level. You can see we have our data layout is in long format. So we have the city name and have the in this case, the map name will go to something drinking, housing access, housing access, housing cost, and also very format and also group name. And so the group number to be equal to the name, that number should be equal to the metric name. They are just the internal identifier we use for easy calculation and we have here the numerators, denominators, and estimate. So for a person who are not doing more advanced analysis with this data, I think that's the important one we have. That's also the main result we present on our website. For data type, we usually mark like because we use some of the survey data, sometimes we put several years together to create these measurements. So for data year type, based on different data sources, we may have different types of data. For example, if this data is from CDC Places project, it might called 2018 1-year model estimate. If it's from this American Community Survey, sometimes it's called the 5-year estimate, like 2019 5-year estimate, because we put 5-year together to calculate this estimate for more stable and reliable estimates across the years. So this is the general layout, and you can find all the dictionary and the overall layout for all the other data sets in our codebook is in page 9. So I can show you a little bit of the data we collect in those CSV folder, in the CSV file. Do you all see the CSV file?
Yep, we do, Euro.
Okay, so you can see this Arkansas table, we have in our downloadable data right now, have a lot of variables. Some are useful, not useful, and it has a lot of options. For example, the things you want to see by different variables, sometimes you just want to see the conclusion. And because it's in long format, so sometimes it's very difficult to see and to compare across cities. Or if you're only looking at one city, and if you're in the track table, it's a lot of somehow difficult to compare them across places. So my recommendation for using this one will be save it in the Excel set. And to only select variables you are interested in, for example, obviously the Arkansas data set, just all the variables that I need. So it will come with a much shorter list and go for the Excel users that the features you can use. My main recommendations of using if you're just doing something information in Excel, I would recommend you condense your data to format something like this. Then you can also select different or you're at the total population, you can also look at the population, or you're looking at only at the total population. Just as an example, and I will transfer this data from the white format, from the long format to the white format. So for example, in Excel, there is a very easy way to change the data format. You can just use the table and select the data you want here and put it in the worksheet. And in here, you will see then you can do some manipulation. For example, I will put our identifier, what I hope at the rows, the name, maybe the state operation. If you're looking at multiple states, but not because we're only map, so we can just not using that. And the map name will put in the column, and group name because we're only looking at the total population. We might not need that, but we might need that in the future. So it can have this value. And then I will put that in the value. By default, it will provide the count value, but for the purpose of this one, we might only just see the sum of them. So by doing this simple transformation, we will usually be able to compare it within Arkansas, which city have the best estimates or have the best health outcome. And you will also be able to easily see all of those things at the same time. But have variables, so basically type it out. And you should be able to figure the city unit factor and the variable unit factor. So if you're only want to look at the GNT and breast cancer death, you can just set it to 2. And so because Excel are for a wide data set, then if you want to use more using this data, and also just copy this data set create and some simple for example, just use this to create application, and you can also create a function using this one. Something that is to go to CS and create some small card based on market users. And this is why I created this all of data. This is not that so actually for this metric. So this is for our download data. So download data are usually easy to access, they're easy to download, and but unfortunately they only have like the most recent year of data. So if you're doing some simple geographic comparison, downloadable data may be best option to have. But if you want to do multi-year comparison, you unfortunately have to use the API. So any questions so far for the downloadable data? So for the API, the first step you do is after you sign the data user agreement, you will see there is a direction asking you to obtain the authorization token, which is just a way to ask you to identify, just to track how many people have downloaded our data through the API. And you can see our API documentation here. So the API is, for the order to use the API, you need to first to obtain the API metric key in our codebook. So it depends on which metric you want to look at. Here is the list of metric key that we use in our API, which is usually pretty straightforward. There's our usual metric name with a little bit of touching it. And so here is the API we have. So the API we have is actually web-based. You have to go to the API.com and access the API data. So for CD metric, you have it here, and for track metric, you just change it from CD to track. And here are some of the parameters that you want to put in for this. So for example, if you're interested in looking at the broadband connection, you just get the metric key from the codebook and the connection, and then put in your API token, and put in the CD you want to look at, and put in the state you want to look at, and put in the data year type, which we also have a list in our codebook on what's the data year type you might look at for each metric. So for example, the broadband connection, because it's a data, you will see this is 2019 5-year estimates. So if you're putting this in the web browser and put in your API number, which this is my API number, you should be able to do something like this. So this is a JSON column I was taught. I know this is not a very intuitive vision of this data, but you can see if you find the estimate, this is the estimate 74.9 for county Parkinson's and data. And if you want to get the year of the data, you just change the data year type to 18, and you are getting a different number, like 70.2. And if you are looking to get more data, for example, the industry example we have, and you will not put including parameters such as state and CD, and you will see this is all the data we have for industry. And because I think the API at each page will only read either 500 or 1,000 rows of data, so sometimes you need to turn the page here. So for example, this is page 1, and then you type it. It will only show us here. So we know that the API is not the most intuitive way to use in this way. So we did develop a little bit product internally at the dashboard for you to easily get API data. So Star is a open source and free software we use. So we developed a function called get API data from our which is still in development. So at right now, we can easily if we put into it will only read the metric, you cannot specify the CD and the state. But if you are looking at to get the API data, you can run something like this. So this is the flow level we want to get you if you want the CD level data or if you want to get track level data. And this is the metric, like I put the broadband connection. So you still need to get the API metric key from there, and you still need to get your API token. And then if you run this, you should get all the multi-year data for all of the CD dashboard for broadband connection. Here, see, this is the broadband data, and you can see this is the data we have. So because this API function is still in development, so we're not releasing this to the public yet. But if you do need to use the API and you do use R, or have some working knowledge of R, I can share this function with you, and you can modify this slightly to get the API data from our website. If you do have any questions, or if you do need the multi-year data and you don't know how to cut this from the API, feel free to send an email to the info@cityhealth dashboard. The data team will be happy to cut a piece of data for you. And we will release this function in the future. So we will modify this and make it easier to use and make it available to the public. And if you use some other software, such as SAS or such as Data, and if you need us to create a easy to get API function in those software, please let us know. Based on we can look at our team's capacity and probably create those functions in the future. Thank you.
Euro, I have one question. So when you were looking at the API from the website, not through the function, you had put broadband connection in 2019 and you subbed in 2018. Yeah, is there a way for if you're looking at, for example, Conway, Arkansas, broadband connection for multiple years at a time, or do you have to look at each year separately?
So you can look at them all together. All you do is just to delete this part, to delete the specification of the year height. So here you will have the multiple year of data altogether. See, 2019, 2017. For broadband, we only have 3 years of the data, and we have that here.
Gotcha.
For example, if you want to see our Arkansas, you can just delete the city specification, and then we will see all the Arkansas data. I think the main challenge to this API right now is in JSON column. So it's not the easiest format to read.
Thank you, that was really helpful. And anyone feel free to take yourself off mute, ask your question that way, or if you're more shy, put it in the chat. I can ask it to Tiro. But now, time is yours to ask any questions that you can.
And stop sharing my screen for now.
While we don't have questions, I do want to show an example of how the user integrated our data, our non-local data, with their locally collected data, in case this kind of spark an idea or question. So Louisville, Kentucky, they are really focused on remediating lines on their service line and their service lines, their pipes, and they have a pretty large outreach towards communities that are most affected by with poisoning across the city. So we have connections with the health department over there, and they were able to zoom into this map. They're able to overlay our data on how they would potential risk with their data on cause effects. So this base map here would really bring those indicate would be able to have housing stock that has greater potential of having lead risk. So they're blue, the greater lead risk in the housing stock, and we indicate the positive lead tests that or positive lead tests that children were testing at their pediatrician's offices. So you clearly see in the dark neighborhood that had that low housing stock is also experiencing multiple positive lead tests across the city. So what this map, this analysis showed or kind of was used for was then to not only direct outreach resources towards that one neighborhood in the central west part of the city, but also it formed the basis of collaborations with community groups that work in those neighborhoods. And in that particular neighborhood is a majority black neighborhood, and so it helped the city better communicate with those neighborhoods and better leverage existing community supports that could help the city outreach those to those residents and develop more sensitive programming towards those residents and policies that really aim to support the residents living in that neighborhood. This is an example of how the world can be used in a real world actionable setting, which is really cool to see. And we have a lot of examples like that or similar to that of folks using our data. So if you have questions about that, we're also happy to share. If no one has questions.